Hi, this is Ajwa Chemeting from the National Minority Equality Forum, and this is For Your Health News. Your health, your news, your power. And I'm here with Aishat, and we're here to talk about the landmark initiative between the National Minority Equality Forum and Blue Cross Blue Shield, the Data Equity Coalition. Hi, Aishat.
Hi, Audra.
Would you like to introduce yourself?
Yes, my name is Aishat Magbade. I'm the Director of Community Health Policy at the Blue Cross Blue Shield Association.
And the reason we have smiles on our faces is because progress is happening, y'all. And really, a major announcement was made at this year's 2026 Annual Leadership Summit hosted by the National Minority Equality Forum right here in Washington, D.C., by the Data Equity Coalition. Aisha, do you want to share what that announcement was?
Yes, the Data Equity Coalition released our State Advocacy Toolkit to align state advocacy efforts on data collection on race and ethnicity with OMB's SPD 15 update from 2024.
Okay, she just said a whole lot there. So let's roll it back and figure out and talk about how did we get here. You know, for those of us that have been passionate about health equity and access to optimal health care for a long time, maybe before it was sexy to talk about health equity, data was always the problem. What's happening with us? What's happening with our communities? What does the data say about what health concerns are really impacting our communities? And about 30 years ago, the conversation was about the lack of data, about racial and ethnic and soci data, demographic data being represented in our health systems so that the health system could be more responsive to our communities. How would you describe the progress over the last 30 years to the update that just happened in 2024?
Thanks, Audra. So in 2024, we had an update to SPD 15 from ONB. So the last update was in 1997. So everyone has filled out their race and ethnicity when they filled out a form, whether it's through a job
Right.
application or any sort of enrollment form. But the new update actually combined the race and ethnicity question into one question and allowed for a broader list of minimum categories. So it included a Middle Eastern North African category,
Oh, wow.
separate from the white category, and also included a broader range of ethnicities that people can select from. And also included the ability to actually write in your ethnicity and select more than one race or ethnicity when you fill out this question. So this allows people to actually really pinpoint who they are and allows them to be seen in the data, which is really important for data disaggregation, which is something that allows you to really break down larger data sets into smaller data sets to show underlying disparities and
Right.
allow people to really be seen in the data that's collected, so which is really important.
Yeah, I love what you just said about people finally being able to be seen and also identify for themselves how they want to be identified. I mean, we've heard this debate over time, right? That, oh, am I this box? Am I that box? It's not definitive enough. And so I think that's really amazing. How can this now translate at the state level? What do we need to see happen since that update in 2024 by OMB that needs to happen now at the state level, would you say?
Yeah, so federal agencies have until 2029 to become compliant with these new standards. So states now have the opportunity to also become compliant with these new standards and update their own data collection practices. So
Okay.
this toolkit, it can be used by coalition members and other stakeholders to work with their state legislatures to update their data standards. The toolkit includes legislative language that could be used to introduce bills within
Right.
states. There's also talking points that can be used when talking about this with different members of their state legislatures and different regulators. And there's also talking points and one pages that can be used on the community level,
Oh, really?
so that different people can talk to their community members and just tell them why it is important for this data collection standards to be adopted across the country.
And if we were to sort of give maybe the 30-second elevator pitch of what community folks could say, what you all could say as our listeners and subscribers about why this is important, what advice would you give to folks to explain to their state representatives about why this is really important for them to do?
So, data is used to inform a lot of decisions that are being made on all levels of government. And if you're not seen in the data, then you're not really being considered in all of the solutions that are happening on all these different levels of government. So, you want to be able to be seen in the data so that you are also being considered in all of the policies, regulations,
Right.
and laws that are being written. So, that's why it's really important for you to ensure that you are being seen in the data so that you are also being considered in the laws and making sure that they also reflect who you are so that you are not being negatively impacted by any of the laws or regulations that are being made.
I couldn't have said it better myself. NMQF has always been about data for a reason. As the largest health equity organization and one of the oldest, we know and we have seen how much systems can change when the data points out the issues. And so, like you said, if we're not seen in the data, then the system can't move how it should and be responsive to our needs. So, we're really excited to be involved in this initiative. We're really excited that this toolkit has come out. I would love to share with our readers and listeners about where they can access this toolkit.
Yes, so the toolkit actually launched during the NMQF Leadership Summit this week, and it's also available on the dataequitycoalition.com website.
Okay, you heard it. www.dataequitycoalition.com. Please access this toolkit, utilize it, talk to your state reps, talk to any of the policymakers that you can talk to that, hey, let's get compliant. Let's make sure that we integrate and make sure that we have the proper data collection standards in our state before what year?
2029.
Okay, you've heard it from here first at For Your Health News. Thank you so much for listening. Please subscribe to learn more and make sure that you get the latest updates.
Thank you.